Excellent. Welcome again, everybody who has just joined. I'm Ginny Chadwick. I'm with the Missouri Eliminate Tobacco Use Initiative here at the University of Missouri in Columbia, Missouri. We're really excited to see so many of you on to hear about bystander intervention training and the Tobacco Wellness Ambassador Program at the University of Missouri. We have Nosse from UT Austin here that is going to cover bystander intervention training. She's been doing work across the state and even the country on helping institutions engage their community in getting best practices, cessation policy, and enforcement going. So Nosse, I'll turn it over to you, and I think you're going to share your screen, correct? I do not see Nosse now. We might have lost her, and that's okay. The University of Missouri Ambassador Program can go first unless she pops right back on. Give her just one moment. Sorry about that.
I do think she's back on, Ginny.
Excellent, thanks.
Yes.
No problem, Nosse. And we are ready for you to share your slides whenever you are.
We are. Okay, let me try that.
Looks like maybe some internet glitches on your part. Nosse, while you're getting things worked out, I think we will start with the Wellness Ambassador Program. So I'm going to share my screen. Excellent.
Alrighty, hello guys. Today we are going to talk about how you can approach to making a case to have an ambassador program, and the training that we went through and the resources that we have read over and learned to make our ambassador program what it is, and necessarily how we approach people and the materials and everything that is needed to make the program work.
So as we know, on both the healthcare system and the college campuses across the country, many policies already exist. But one of the challenges that we hear universally is that it's hard to get it enforced, that maybe people are continuing to use tobacco products on the campus. And so through a grant through the American Cancer Society on the tobacco-free generation, and now through the Missouri Foundation for Health grant, we've really been able to create a robust tobacco wellness ambassador program at the University of Missouri that we're excited to help other campuses replicate throughout the state. So we really want to show the strategies that we have created to make an effective enforcement program. And this really starts with recruiting ambassadors, and you're going to hear from many of our great ambassadors that are working actively on the University of Missouri campus today. But we have been able to utilize not only the grant funds, but we have work study students, we have students who are in health sciences getting internship credit, Masters of Public Health students, as well to leverage our partnerships and funding to make sure that we have enough ambassadors to cover the entire campus. We also start by training our ambassadors, and the initial inception of our program really is coming from the University of Kentucky, started a tobacco ambassador program on their campus several years ago, and they've written up a really great journal article that talks about the steps to training and the resources needed for an ambassador program. So we start by having our ambassadors read this journal article. One of the most important things that makes our program work is the Wellness Resource Center. So Michelle's going to talk a little bit about this center and how we partner for the ambassador program.
So the Wellness Resource Center is part of Student Affairs. It's in the Department of Student Health and Wellbeing at Mizzou, and it's really an excellent place to house the tobacco ambassadors and work in collaboration with the Eliminate Tobacco Use Grant.
Alrighty. RX for a Change is a foundation of training that we use for our program for smoking cessation. It has like multiple like journal articles for us to like go over, and it's just important to like understand why we are doing what we're doing and how to beneficially like impact and have an understanding of why.
So in approaching people we do on campus, we understand how important cessation resources are. So we have provided a generic list of resources that you can identify on your campus so you can provide your community and refer them. This specifically is a list of things for our campus, and it's split up by on our campus, so the Wellness Resource Center, and then we have it split up by county, and then we have it split up by the state.
And then this is the brochure that we partnered with Partners in Prevention to make. And this is more geared towards a college student, and it just has like the ways to quit, the steps that you need to take, and then a few of like the other little links to go to if you want to quit.
So as we're making an approach to any policy violator on our campus, really the lens that we're using is how do we provide them in the moment cessation resources to help them quit? We're not on our campus to catch somebody for violating, but really to inform them that the policy exists and to make sure that they have the resources they need to help them to quit.
My apologies. Along the lines of providing the resources, when the tobacco ambassadors are out, they can provide this as another resource, offering a virtual group class. Previously, it was in person, and we have recently moved it to be all online, and is now moving towards being available for the entire state to be able to attend.
Yeah, so we have 2 certified tobacco treatment specialists that hold these virtual classes, and almost at any time throughout the month, somebody could join the class. So we are always eager to get more people participating in these virtual classes.
All right, and so when we do make these approaches and we talk to someone who is not in compliant with our policies, we do go ahead and always offer nicotine replacement therapy, both because we want them to be comfortable and we want them to know that we are not against them. We just need them to be in compliant with our policies for public, safe, and health reasons. So we at our campus, we give out nicotine gum or nicotine lozenges, and we do give out a full sleeve at a time. And we as well give out these instructions that you can see on the screen so that they know exactly how much to take. We did at one point give out nicotine patches too, but it ended up being a bit complicated dosage wise, and they weren't as popular. Yeah.
So we also have a website where we can have students come in and report violators on our campus. We understand that we can't provide surveillance 24/7, so it does give a sense of community involvement. So on this website, we have a form where you can report an issue, and on that form, we can respond to that, and we also provide what our policy is on our campus.
And then these are the scripts that we use. For most of our approaches, we do try to use the shorter script, although like the longer script has everything that we need in it. The shorter script is just like, hello, my name is Jemiah and this is Elizabeth, and we wanted to let you know about Mizzou's tobacco-free campus. If you would like to use tobacco, we do ask that you leave, but we can offer you nicotine replacement therapy for the moment.
Yeah, and so as Jemiah said, most of the time we do try to keep it brief, especially right now. You know, close interaction is not something that you want to sustain for a long time right now, but we do sometimes will get questions. People will specifically ask, like where on campus we work and what exactly we can offer them in terms of help, or like where exactly they can go if they do want to smoke. So we just kind of play it by ear depending on who we're approaching and what the how they're responding. We also, with every approach that we do, we report and track our approaches through a Qualtrics survey. And so in that survey, we say which ambassadors approached, we give the date, what type of violation it was, including how many people we approached at a time, what kind of tobacco product they were using. We also we have a heat map of the campus that we use where we point to where exactly the approach is being made, which helps us determine which areas we need to be patrolling more often. For us, we have a very unique setup, whereas we patrol the MU campus as well as the MU Health campus. And then we have the VA, which is very close to our campus. And so we interact a lot with very different demographics. And this gives us kind of more insight into who we're approaching, when we're approaching, and where we're approaching, and things like that, so that we can better target our resources.
The materials that we need to make our job happen is a big thing is we need to be able to identify who we are, because we say our name, but you also still need to look professional and see that we are with Mizzou. So we do wear a uniform. It's typically a t-shirt, and we will have a name tag on. But a big thing is that makes our job work is we are on a very large campus, and we do patrol the university hospital as well. So it's important for us to be able to use the golf cart, and it's allowed us to have a beneficial to where we can patrol areas more like fluently and more quickly, because we only go out for a couple hours at a time. But if you have a small campus, you could possibly do like by walking, but we use a golf cart.
As Maddie was saying, yes, the golf cart does make it a lot easier to get around campus. We did have to walk for a week, and that was not as efficient as the golf cart was. But the more important things that we need aside from the golf cart are like the NRT, the cessation resources, the brochure, and the tracking survey. And we keep all of that in a backpack, and we just have our phones on us for easy access to complete the survey while we are going around campus.
Yeah, so as I said previously, we do interact and make approaches with a lot of different populations just due to how unique our campus situation is. At this point, because we've been patrolling for so long on the MU campus, we deal a lot less with students, and we deal a lot more with hospital visitors and health staff, which really changes the dynamic of approaches, because it's no longer somebody who is maybe your peer approaching. It is a lot more so a college student approaching someone who is either at their workplace or who is at the hospital, which can cause interesting dynamics and sometimes is not the recipe for incredibly polite approaches. And so there's a lot of different ways that we have to kind of work around that when we're approaching.
Yeah. As Elizabeth was saying, we don't make very many approaches to college students anymore because we don't see them as much as we see like the older demographic smoking. But I've been working for this job for 2 years. So like when my first year working here, I did see a lot of college students, and they definitely complied more than the older people because they obviously do not want to get in trouble, even though we do not fine them or anything. They just think that they will. So they are easier to get to comply. But I've definitely seen a decrease in the amount of smokers, especially at the entrance of the hospitals and the visitors, because I think that they know and are more informed about our policies since we've been doing this for a few years now.
And when we make approaches, they're non-confrontational, right? As Elizabeth said, maybe they're not always friendly to us, but we are always friendly to them. So we are informing them, requesting compliance. It doesn't mean we always receive compliance, but based on our data and tracking, over 90% of people who we request compliance do comply. And so, we have a 90% compliance rate, which is a whole lot better than if we were not making the approaches. It also gets to the point where people know that the the policy exists. And so if they see the ambassadors coming, they will cease using their tobacco products and walk away. So we have identified throughout this process key stakeholders to really make it work. And it really takes a village to make this happen. And so we are grateful for all of our partnerships. MU Healthcare has been generous in providing the NRT for the healthcare campus, and our partners in prevention have helped to provide the NRT for MU campus. And getting buy-in to be allowed to do this program it's been really helpful. It's taken time. We definitely took a break when COVID first hit and nobody was on the MU campus, but we have been back going. 2 ambassadors go out at a time. It's outdoors. They're always in their mask, and we try to keep it as safe as possible. As you heard from our ambassadors, they keep their distance in providing the information to those who are violating, because unfortunately, we know those who are violating are not wearing their masks. So they're in violation of multiple policies on our campus. So as the Missouri Eliminate Tobacco Use Initiative, we are here to provide resources on policy, training, cessation, and we are looking forward to providing partnership. I do believe that Nosse now is back up. Nosse, are you with us again?
Yes, hi. Yes,
Excellent.
I am back. I want
Great.
to apologize to everyone about that. My router decided the absolute wrong time to start messing with me today. But no worries, I got connected through my, thank gosh for that. So whenever y'all are ready for me, I can go ahead and share my screen.
Go for it, Nosse. You are cutting out just a little bit, but much better now. So if I need to share my screen, I'm happy to, and we'll take questions at the end.
Okay, awesome. Actually, if you don't mind, let's go ahead and try that, and maybe that will work a little bit better for us if you don't mind pulling up the slides.
No problem.
Perfect. Thank you so much. Well, I wanted to introduce myself again. I work at UT Austin. I've been there for about 5.5 years now, in 2 different roles. My first role at the university was as the tobacco-free campus tobacco-free campus coordinator. So within a few months being there, I quickly realized that the job I thought was going to be a little bit easier definitely had a lot of uphill climbing and changes to go. So we can get to the next slide now. Oh, were you able to flip over? I think it's about to.
Did it not?
Oh, there we go. Perfect. Oh, no, it's there now. I, as the tobacco-free campus coordinator, what I did was number 1, share information about our tobacco-free campus program and implement and promote resources for our campus, improve awareness and understanding of the policy adherence. Hop to that next slide in the cart now. So really, we've had this policy in place at this time since early April of 2012, but there really wasn't anything other than the written documentation on our policy website. Outside of that, that's all that had happened. As far as how this particular policy came into being, it was really a partnership between our wellness network committee on campus that consists of faculty, staff, and students, and in addition, our student government. And interesting enough, our student government at the time had voted for a transition of 10 years for us to go fully tobacco free. As secret funds and just really our health and wellness initiatives started coming into question at the university, we quickly realized that the timeline would have to shrink a lot. So that being said, it went from a 10-year conversation to talking about how we can just transition quickly within 3 to 4 months. So we can get that next slide now. So the training objectives of our ambassador program. Number one is review of our tobacco-free campus policy, and then an understanding of enforcement and bystander intervention. And three, like knowing what resources are available at UT Austin. Next slide. So when we started working on this, the creation of our Clear the Air campaign came to fruition pretty quickly. And we went ahead and updated some signage that had been in particular buildings to ensure that we had the same type of signage all across campus. So that included places that weren't necessarily central to UT campus, but places like our North Campus locations and our facilities buildings. And what that also included was the education of our building managers, so they had an understanding of what exactly our policy was, what steps they needed to make to ensure our policy was followed, and what actions that they could take for individuals that were not following the policy. Because when you have large policies like this, there tends to be some confusion as far as which offices manages this, who's in charge, like are there any real like penalties or anything like that. And that's what part of our education was, helping for our fellow support systems around the university help us manage this policy and be really our firsthand ambassadors. Because the truth of the matter is, as far as my first or second week there at the university, I was under the impression that I would be able to generally manage the campus. But I quickly realized that was not possible. I did hear one of y'all mention in reference to the golf cart that like there was a big difference between walking around on foot in a giant campus with the heat coming down on you and cruising in a really cute golf cart. So that's when we got Little Smoky that was shown in the earlier slide. So we can actually go to the next slide now. So our tobacco policy, like many of y'all's, prohibits the use of all forms of tobacco products, including vape pens. So this is language that was initially not in our policy and had to be added around, I think it was in 2017 is when we made the official update to the policy, because the language didn't necessarily fit what the cultural jargon what had been updated to. At the time, we were using language like electronic nicotine delivery devices. And when we are working with different populations, it's so important to ensure that we are able to express what the policy is and explain in language where people have understanding of. So we can go to that next slide now. So this is something I always love to share because we've seen so many variations of this image, and how things have changed from then to now. But this is something I often share with our ambassadors. Like, look, it hasn't changed. They're still trying to target us in very similar ways, and this idea of freedom, which is heavily promoted among vape companies as like you take back your right. And it very much leaves out the individuals like most of us that would like that right to breathe free air, especially within the current times now with COVID. We're seeing more than ever that maintaining strong and healthy lungs is important, and can have, you know, big impacts on things like COVID. You know, you would be more likely to have worse symptoms if you are a heavy smoker. So we can go ahead to that next slide now. This was just some information that we also share with our ambassadors, updating them on, you know, again, what's new about it, who uses it, and what exactly e-cigarettes are. Because for the longest time, I know, even again as early as 2017, I was hearing this word e-cigarette. I was hearing electronic nicotine delivery devices, but there were lots of different variations, lots of different looks of it. So this part of the education for our ambassadors gives an opportunity for me to showcase the different types and how e-cigarettes will continue to evolve through time. So this is actually an exact copy of the ambassador training that I do provide to our students. So our compliance at UT Austin is, we can actually go to that next slide. Our compliance at UT Austin is grounded in that we have general respect for everyone in the UT community. So we built out in our UT website our compliance and anonymous reporting tool. And we can go to the next slide. So within this first week, we realized that there was definitely a big problem. We can go ahead and skip this one now. And we started to collect data through this reporting tool. So as people submitted on our online reporting tool saying, hey, like we saw someone smoking at this time, smoking this type of tobacco device, that data, very similar to what was shared earlier, really created a foundation for where we needed to have more ambassadors present, or have more signage present, and find different ways to share that information. So this was very valuable to us. So one of the things first off is that we can see we had a lot of people at the library smoking. So we found that we also had a lot of students that were smoking on campus, contractors, because of the ever-changing environment of our university. And we can actually skip ahead 2 slides here. So how can we build collective responsibility? This is something that we worked very closely with Be Vocal, our bystander intervention program at UT Austin, to really expand on the understanding of building collective responsibility and being mindful of other people's space as well. So what I'm gonna do, just for the sake of time here, is I'll go ahead and I am going to launch our tobacco-free ambassador video for us. I'm hoping this works over here. I will throw it in the chat as well, just in case, so y'all can check that out later. But let me go ahead and click on it, and let me share my screen. All right. Can everyone hear that okay? Was that volume all right? No volume?
No volume.
No? Okay, let me get this. Give me one moment. I think I just have to click something else on that Zoom. Share screen and share computer sound. There we go. That should be better now. Does that sound okay now?
Hello, my name is Hugh Farnswell. I'm here today to deliver an important announcement. If you're watching this video, chances are your institution is already a designated tobacco-free campus. The new policy states that all cigarettes, cigars, pipes, water pipes, hookahs, biddies, Kratex, electronic cigarettes, vape pens, smokeless tobacco, snuff, chewing tobacco, smokes, ciggies, stogies, wiggies, squares, dips, darts, butts, mods, and any other non-FDA approved tobacco delivery devices are strictly prohibited. Now you might be saying to yourself, Hugh, what can I do to inform my peers about this new policy? By the end of this video, you too will have what it takes to clear the air. Before we get started, it's helpful to understand a few basics. A, assume the person is unaware of the policy. B, be polite and friendly. C, clear the air by explaining that tobacco use is not permitted on campus grounds. Let's give it a try. This is Sarah. This is her first opportunity to clear the air. The only problem is that she's really into her book and she's not much of a fan of confrontation. What should she do? Easy. She should assume that the person is not aware of the policy.
Hey, what's up? You may not know this, but smoking actually is not allowed on campus.
Oh, sorry, I didn't know.
Yeah, it's okay, no worries.
Thanks.
Yeah.
Great job, Sarah. Now you're starting to clear the air. But sometimes things get a little trickier. This is John. He's on his way to class. Let's see how well he knows his ABCs.
Hey, excuse me, man. You might not have heard about this, but there's a new policy that bans smoking.
It's not smoke, bro. It's vape. It's way better than smoking.
As well as vaping.
Look, come on, dude. I just need to blow some steam every once in a while, man. Plus, I'm stressed. I got finals coming up, and if I don't make at least a C, that's it for me, dude. Do you know who my dad is?
This is a pivotal moment. John has assumed correctly that his fellow student is unaware of the policy. But now he must remember to be polite.
Who came up with this policy, man? I need a lawyer. I'm gonna talk to a lawyer. I'm gonna take it straight to the dean. This is so dumb.
Okay. Yeah, no problem. Just hope you get that figured out, man.
Give yourself a pat on the back, John. You've done your part to help clear the air. If the person is being non-responsive, hostile, or just weird, remember to be polite and simply walk away. Don't let a confrontation escalate. Now that you're starting to understand some of the more advanced concepts, let's shake things up a bit. This is Zach. He just finished his first class of the day. Now he's enjoying a few minutes of fresh air before he heads out to his next one. Uh-oh. He just noticed a well-known professor who's about to be in gross violation of the policy. He wants to be an agent of change, but worries that he might be out of line. What should he do? That's right. Assume, be polite, and clear the air.
Excuse me, ma'am? I just want to let you know there's a new policy in place, and smoking isn't allowed on campus.
Oh, thanks for letting me know. Totally forgot about that.
Remember, the tobacco-free policy applies to everyone on campus, regardless of age, status, or rank. Great job, Zach. Well, I'm afraid that's all the time we have. I hope these tips help empower you on your journey to become an agent of change. So what are you waiting for? Get out there and do your part to help clear the air.
Oh. Stop that share. Oops. All right. So I hope everyone saw that okay without too many pauses. I do want to mention that Mr. Hugh Farnsworth, our actor, just fun fact, he actually played Jennifer Lawrence's dad in a short film like 2 years ago. So that was his little claim to fame. But that's a video that we share with every ambassador training with the basic ABCs on how to approach individuals who are non-compliant with our tobacco-free campus program. What we have found is that the main usage of bystander intervention, we can just go ahead and throw that definition up there. The bystander intervention is recognizing a potential harmful situation or interaction and choosing to respond in a way that could positively influence the outcome. So that includes assuming that the person does not know about the policy, being polite and respectful in that approach, and then clearing the air, just letting them know about what steps they can take to not continue to ignore the policy. And what I've found personally and in interactions and data collected by our student ambassadors is that in general, those communications are friendly. Because I think of it when I'm doing these trainings, I very much think about it like in customer service, right? Like in my customer service jobs that I had through high school and college, if a customer already kind of approached me in a bad mood or irritated or whatever, as much as I would try, there would be a little bit of that pressure kind of mirrored back to the customer. And when you have someone approaching you in a more friendly way, that again is mirrored back. So essentially, the most important thing that I specify in this training is that we need to treat other people like we would want to be treated. And that means being respectful, and then also just learning how to read people's environment and body language. So in the past, like when we've confronted some people or before we've confronted some people, if we can kind of tell that there's some, external stress or, they may seem to be heavily irritated, that may be a conversation that we save for maybe when we run into them another time, or increase signage, or be there if we know they're there at a certain time, be there right before they get there. So we can, be like, hey, like before they light up, this is the situation. But throughout, I think, again, to repeat, the most important thing is having respect for everyone involved, because at the end of the day, we all have addictive tendencies, and this person to specifically happens to use tobacco products for their stress relief. So we should be mindful of that. At this time, we do not provide nicotine replacement packets to students that we approach. It's something that we have been discussing with our University Health Services to provide in 2021. Hopefully, when we're back in person, we'll see what happens. Things are changing weekly, if not daily. But I think that actually wraps up everything on my end. But I did go ahead and drop the link for our Vimeo video there at the bottom. And I had some more information in the slides, but we can definitely make those available later on. It really just kind of goes into more detail of what we saw in the video today.
Excellent. Thank you so much, Nosse, for sharing what you guys are doing at UT Austin and giving another perspective on and more in-depth on making those bystander approaches. So I do want to open it up for questions. I'm going to, stop there we go. Open it up for questions if anybody has any. And then I can talk a little bit about the assistance that we can provide to campuses who might be considering either on a healthcare campus or so questions for Nosse or any of our ambassadors? Okay, it's pretty quiet. So just from our perspective, so we are, as I mentioned, we are funded through a Missouri Foundation for Health grant, and we offer a annual summit where we provide information on policy, prevention, and cessation. And obviously these webinars are an additional way to get out resources. We are wanting to help other campuses across the state of Missouri to replicate this program. And bystander intervention and our wellness ambassadors, and being able to provide the NRT and provide that in the moment cessation intervention. So we do have resources financially available to campuses who are considering. So if you know of a campus that would be interested in starting this program, please reach out to us. All of the resources that we went through on our webinar, we are happy to provide to you. So if you guys would want to do the tracking, we're happy to give you that Qualtrics file so you could do the tracking. We found it really interesting to identify, what products are they using? What NRT are they taking? We have been able to budget the amount of NRT that we need per month, right? We know financially what we're giving out. We know, lozenges were more popular than gum for most part, but Jemiah will tell you recently gum has been more popular. So, and we can tell you to the detail of in which demographic it's more popular. Ambassadors, do you guys have anything additional now that you've seen Nosse's presentation that you want to add about what we're doing?
Just going off of the video that she just showed and making approaches to your professors or people who work for MU, it does seem a little intimidating at first. I know when I first started the job, it was intimidating to go approach somebody who works for Mizzou because I'm just a college student, or approaching people who work at the hospital. So it does you just have to realize that everybody has to follow the rules, and it's our job to not enforce the rules, but kind of. And so seeing the video was very helpful.
And I actually do see a question in the chat. How much are the NRTs per month?
Yeah, so I would say that during COVID, it's been unique, right? So there's been times that we have more people on campus and less people on campus, but we were able to track how much NRT. So we did this program for a 9-month period prior to COVID hitting. And so we were giving out an average of about $250 a month in NRT. So it's actually, Jemiah, do you want to talk about the amount of time that people typically accept NRT when you're making those approaches?
You said the amount of time?
Yeah, how often do they?
So when I first started working with the ambassadors, I would say almost every single time we went out to make approaches, we ended up giving out NRT lozenges more so than gum. But as of late, we haven't been handing them out. Last week I didn't hand out any. So in the month, I would say that we only hand out 2 or 3 packets of gum and just 1 packet of lozenges.
Yeah, we're definitely seeing a decrease in violations, and that's probably twofold. There's less people on the campus, and I think that there's just a lot of awareness of you have a mask on, you don't want that hand to mouth movement, and we know that unfortunately you're at higher risk of contracting and transmitting COVID if you are using tobacco products.
There was a question in the chat asking if we gave out a whole bottle of lozenges, and yes, we give out a whole bottle of lozenges and a whole sleeve of gum. So the boxes come with 3 bottles of lozenges, and they each have 24 in them. So we give them a pack of 24, if that makes sense.
And people are
and that's so good.
Go ahead. Sorry.
Oh, sorry. Yeah, I was going to say, and that's really good to hear, because I would note that one of the barriers initially for us was finding a way to purchase. We do have quite a bit of funding, But you know, as comes with lots of different types of funding, there's line items on how we can spend it. So we have been trying to you know, figure out the best way to use that funding to be able to legally buy these things. But alternatively, at UT Austin, what we've done is we are partnering with the Texas Quit Line. So we then, our nurses at UHS, and then if the individual does reach out for NRT, then we send it to the Quit Line, and the Quit Line provides those resources free of cost to the client.
And Neely, I can provide you with our data so you can see what it's costing per tube and per sleeve of gum. So the lozenges are more expensive than the gum to give out. But you know, for some people, this is their first time using NRT, right? And so this is getting that just early introduction to what NRT, how NRT can help somebody who's interested in quitting. And then, I mean, people are really grateful for it. And we find that it really does incentivize compliance, right? When they're not in withdrawal and they have something, you know, we have done approaches without NRT. Jemaya, you want to cover that really quickly on the feeling and the difference between with and without NRT?
Yeah, so during the beginning, once we first started going out this year, we weren't able to hand out NRT because we didn't have like the funds for it, and we didn't have it, like the Wellness Resource Center didn't have it. And so we started going out, and you can tell like people were just like, oh my God, they're just like coming up to tell us not to smoke, like they don't really care. But then after we got the NRT, like you can tell people were a lot nicer towards us. They felt like we actually cared about them, and it wasn't so much as like, oh, we're just doing our job, like you need to leave campus. It was more like, oh, we want you guys to feel good while you're on campus, so let's give you the NRT to help.
Other questions? All right, well, thank you guys so much for joining us. We did record this, so we'll make sure to get it out to everybody. And I'm going to put my email in the chat box. Feel free, if you want any additional resources, to email me, and I will make sure to get those to you. And that's including, you know, our Qualtrics form, the NRT use, anything that you feel would be helpful for you to move forward. And, you know, we are happy to do ambassador to ambassador training if this is really something that you're considering for your campus. Thank you all for joining. And
thank you for having me. I appreciate it. Sorry for the technical difficulties.
No problem. Nothing special. Thank you for doing that, sharing with us.